Welcome to Wellness Health Services. I'm Dr. Joshua Derito, a family physician. I have interest in cancer prevention and treatment and also public health. In this podcast, we are talking about nutrition and cancer. And we are privileged to be joined by a nutritionist, and I will welcome her to introduce herself.
Thank you, Doctor. My name is Miriam Zilani, nutritionist at Wellness Health Services. Thank you.
Yeah, as we dive into nutrition and the cancer, possibly we can start by talking about nutrition in general. What is the role of nutrition in our overall health?
Number one role of nutrition is to improve our nutritional status to normal. Number two, we are going to improve the immunocompetency because we find that mostly if one is sick or has cancer, their immunity may be compromised. So we are going to improve their immunity. Number three, we are going to promote wound healing. Mostly if one has a wound, you have to improve it through the diets that one is supposed to consume. The other point is to improve the quality of life through good nutritional status.
So, nutrition and the overall health has been implicated in cancer. So, possibly you can tell us what are some of the things that people do with their diet that make them to have increased risk of cancer, and what are the things that we can do to prevent ourselves from getting cancer nutritionally.
In diet, in prevention of cancer, you find that most of the people with cancer, they may tend to consume those foods which contain carcinogens and which are causing agents of the cancer. So for one, you find that they mostly consume foods that are like they contain lots of sugars and processed foods, and these foods tend to increase the weight and also increase inflammations in some parts of the bodies. So for one, the patients or cancer patient, they should avoid consuming those foods which are processed, or more so the processed meats, because they contain the nitrates. The other point is that they should avoid consuming alcohol, as we know that alcohol is one cause of the throat cancer and also mouth cancer. They should also avoid intake of cigarettes, as cigarettes are known to be causative of throat cancer. And also the patient should also avoid intakes of high fiber diets.
Okay, thank you very much for that brief. So, in most of the cancers, you find that being obese is one of the issues that is coming out. That people who are obese, they have higher risk of getting cancer. Possibly, you can shed some light on how can people manage their weight so that you don't become overweight, and what are some of the tips that people need to look at so that they can keep their weight to optimal. And also you can help us understand how do you get, what is your optimal weight so that people understand this thing of being obese. What is it exactly?
Being obesity is acquiring more weight than the required weight one should have. So we are going to use the BMI, the body mass index, in calculation of the optimal body weight of an individual. So for us not to be obese, we should consume foods high in fiber, we should consume adequate fruits and vegetables, we should avoid loads of high fat diets and avoid processed foods, so that we can be able to have the optimal body weight. And also we should do some exercise which will help in reducing our body weights.
Thank you very much. It seems like eating a very healthy diet, a balanced diet, is very critical for preventing you from being obese, and also incorporating exercise in your daily routine. Now, tell us more about the foods that people who have cancer, what should they take so that they improve their healing. They also avoid what are some of the do's as far as diet is concerned and cancer.
Okay. People with cancer should consume adequate fruits and vegetables. These fruits should contain minerals, vitamins, and also the antioxidants. These antioxidants will help in reducing and preventing cell damage by neutralizing the free radicals. So you find that if they consume the fruits and the vegetables high in minerals, vitamins, and also the antioxidants, they will help in reducing the carcinogens. The other point, they should take high amounts of water, like 5 glasses of water. This is to help them eliminate the toxins in the body. The other point is they should take lean meats. An example is the chicken, also fish. Fish is important because it contains omega-3 fatty acids. These omega-3 fatty acids help in freeing free radicals, and also it helps in preventing inflammations. They should also consume foods that contain healthy fats. An example of healthy fats, we have the avocados. We also have the olive oils and nut seeds. And they should also consume foods with whole grains. This, an example, they contain high fibers. These high fibers will prevent constipation and will also increase the transit time during the fecal materials.
Okay, so thank you very much. As we continue to explore uh, cancer and also living healthy, so possibly what would be your main message to the general public and also to the people with cancer as we move on? What would we need to do as a society and also the individuals affected by cancer?
We should increase awareness and the importance of nutrition in cancer care. The other point, we should also increase access of healthy foods to the cancer patients, and also advocate for dietary counseling as part of cancer treatment plans.
Okay, thank you very much, Miriam, for those tips. As you have heard, the main thing is when you look at diet and cancer, as a society, we need to increase our intake of high fiber diet. We need to incorporate the appropriate types of fats in our diet. We need to incorporate exercise in our lifestyle. This will help us to prevent cancer, because it will prevent us getting obese. And also for the cancer patients, it is always important that they get a nutritional consultation so that they are able to take the appropriate diet, so that this will help in their treatment, and it will also help to maintain their body weight and also accelerate the healing process, be it from the surgeries they have gone through, be it from the effect of the chemotherapy or the radiotherapy. So what we are getting from Miriam is that nutrition is core, and let's also incorporate it in our lifestyle. Let's incorporate nutrition in the management of cancer patients. Thank you very much for watching. If you like this content, please remember to subscribe. Also share it within your circles. And also for personalized care, please feel free to call the number on the screen. Either we can consult online, or you can also present yourself physically at Wellness Health Services, Catalonia in Machakos. Thank you very much for watching.